An FDA advisory panel is raising some very serious questions about a key ingredient in popular cold medicines. The 16-member panel unanimously concluded that 10 milligrams of phenylephrine works no better than a placebo to unclog your stuffy nose. We've all been there. Phenylephrine is the main ingredient for congestion in many common over-the-counter medication pills. You see them on your screen. I'll bet you have some of them in your medicine cabinet right now. Hello, my name is Gayle. There they are, right there on the screen. I got all those guys. The Consumer Healthcare Products Association, a trade group representing non-prescription drug makers, is pushing back. They say the ingredient is safe and effective. Chief Medical Correspondent Dr. Jon LaPook is here to sort it all out for us. Jon, you have the floor. What exactly does this decision mean?
All right, first of all, to be clear, we're talking about phenylephrine 10 milligram pill. We're not talking about the nasal spray.
Which is good.
And we're great. We're also not talking about the other ingredients that may be in a cold and allergy, medication you're taking. And I spoke to Dr. Jennifer Lay last night. She was one of the 16 people, this advisory committee, that unanimously said, we've looked at the literature, we think that the studies are good, and we think that it doesn't work. And she explained to me, a main reason she thinks it doesn't work is when you take the pill, you swallow it, it goes into your stomach, then your small intestine, it gets absorbed. It goes to your liver, and it gets broken down. And by the time it gets to the lining of your nose, there's just not enough of it there to be effective. That's what they believe.
Okay.
And then that's why the spray would work, it's right on it,
Right there.
as opposed to taking a pill.
So as we head into stuffy nose season, what should people look for or do to try to clear things up? What kind of medication would work?
Well, first of all, the nasal sprays do work, and it's not just the decongestants. There are things that are antihistamine sprays, and there are steroid sprays. There's also just nasal saline irrigation that works. And there are some pills that work. You need to talk to your doctor. These over-the-counter, behind-the-counter pills like pseudoephedrine that can have some side effects. You need to talk to your healthcare provider before doing that. But the main thing here is that you don't want to take a medication that, number one, doesn't work.
Right.
And number two, as one of the committee members said, well, it's, what's the harm? Well, if it doesn't work, but it may be stopping you, especially if it's the only pill, it's the main ingredient in the pill you're taking, from getting something that does work.
Okay, so if it's not effective, is that the only downside that is stopping you from getting some pills that may work, or is there any other downsides?
Well, one of the committee members had a term that I had never heard before, financial toxicity, which is, do you want to pay for something that's not working?
Now, I never thought about that.
The Trade Commission is pushing, the Trade Association is pushing back on this. This is an advisory committee, and the next step is going to be for the FDA itself to now look at this.
I'm so confused because I'm telling you, when I take some of this stuff, I wake up, I take NyQuil, Dayquil, whatever it is, I actually feel better. Are you saying that one ingredient may not work, but others in the medication are working?
Yes.
And then, I heard you say you should read the labels. Well, I'll read the labels. I don't know what the hell I'm reading.
Right.
I read the front part.
The thing with the P, the other thing with the P, the thing with the...
Yeah, I mean, I look at it, if it says stuffy nose, mucus, da-da-da, I'll take that. I'm not sitting there reading the labels. So if I'm reading the labels, what am I supposed to be looking for?
So I would push, I understand that, and we all feel that way. You just want to see what it does.
Yes.
I think you have to be an educated consumer, especially if you're giving it to your kids. Yes, there are some funny-sounding names there. Look them up. I mean, you Google lots of things during the day.
That's true.
Phenylephrine is something that's in there. You can look just for that, but there are antihistamines, there's acetaminophen, there are expectorants like guaifenesin. Fancy words, but I think it's worth it to really know what you're taking.
All right, and we'll see when the FDA takes a next step here. We'll be waiting. Dr. Jon LaPook, thank you very much.